Imagine this. You wake up, sit at the edge of the bed, place your feet on the floor, and for just a second, only a second, something doesn't feel completely steady. It's not a strong dizziness. It's not an immediate fall. It's just a subtle instability, as if your body needs to recalibrate before taking that first step. And you tell yourself, it's normal. I'm over 60. But what if that small adjustment isn't simply age? What if it's the quiet manifestation of an internal imbalance affecting your nervous system, your muscles, and your stability without you realizing it? For years, we've been told that vitamin D is mainly about bone health, that its primary job is helping calcium absorption and preventing fractures. And while that's true, that explanation is incomplete. Vitamin D acts as an active hormone in the brain. It influences neuromuscular communication. It plays a role in how precisely you react when you stumble. It modulates the speed of your postural reflexes. After 60, something changes that few people talk about. Your skin produces less vitamin D even with the same sunlight exposure. Your kidneys activate it less efficiently, and your time outdoors often decreases. The result is a silent storm that can gradually lower your levels without causing dramatic symptoms. No sharp pain, no obvious warning, just subtle changes. Feeling slightly unsure going downstairs, walking more cautiously in dim lighting, reaching for the wall more often than before. Because balance isn't simply not falling. It's a sophisticated system where the cerebellum, the vestibular system in your inner ear, your vision, and thousands of receptors in the soles of your feet work in millisecond precision. When vitamin D levels decline, the receptors that depend on it can become less efficient. Communication between brain and muscle may slow slightly, and your fast-twitch muscle fibers, the ones that save you when you trip or misstep, may weaken. That slight delay can increase fall risk without you perceiving a dramatic shift. And here's where another critical factor enters the conversation: omega-3. Omega-3 fatty acids don't just support heart health. They are structural components of neuronal membranes. They influence synaptic communication, and they help maintain the brain health that allows rapid, coordinated responses. When vitamin D and omega-3 work together, they support both neuromuscular function and cognitive processing speed, reinforcing not just bone health, but the entire system that keeps you upright. Strong bones alone do not guarantee stability if muscles are weak and reflexes are delayed. Balance is a biological symphony, and every instrument matters. Studies in older adults have shown that low vitamin D levels are associated with increased fall incidence and proximal muscle weakness, particularly in the legs. Not because aging equals inevitable decline, but because the body requires strategic adaptation and preventive action. So how do you know if this silent factor is affecting you? The only precise way is through a blood test measuring 25-hydroxyvitamin D. Guessing is not enough. Supplementing blindly is not advisable. Both deficiency and excess can have consequences. If levels are low, the solution is not extreme. It's strategic and progressive. Safe sun exposure under medical guidance, appropriate physical activity, and mindful nutrition. And this is where a well-structured vitamin D food list becomes more than a dietary suggestion. It becomes a stability strategy. Food is not just nourishment, it can be part of your structural defense. Fatty fish such as salmon, sardines, and mackerel are powerful because they provide both vitamin D and omega-3, supporting neuromuscular coordination and brain function simultaneously. Cod liver oil, traditional yet potent, has historically been used to reinforce bone health and vitality. Egg yolks offer moderate amounts that contribute cumulatively. Fortified foods such as certain dairy products, plant-based milks, and cereals can complement intake. UV-exposed mushrooms provide a plant-based option that can help support levels. No single food is a miracle solution, but together, they create a nutritional framework that supports stability when combined with intentional movement. Because vitamin D works best when muscles receive mechanical signals, when you practice controlled sit-to-stand movements, when you walk with awareness of each step, when you gently challenge your balance while holding onto a safe surface. The brain needs biochemical support and mechanical stimulation at the same time. It's also important to remember that balance depends on proper hydration, stable blood pressure, healthy vision, and inner ear function. But when vitamin D is low, the body loses a critical piece of the puzzle. That small second of instability when you stand up could be the first whisper that something needs attention. Not to create fear, but awareness. The body rarely collapses without warning. It almost always signals gradually. Understanding that vitamin D, omega-3, and bone health are interconnected parts of a larger system can change how you view aging, not as inevitable fragility, but as a phase that requires strategic care and informed decisions. If you recognize these subtle signs in yourself, don't automatically attribute them to age. See them as an invitation to test your levels, consult your healthcare provider, review your nutrition, strengthen your legs, and take proactive control. The difference between walking with hesitation and walking with confidence may lie in decisions you make today. Small, consistent decisions that allow each step to feel steady, secure, and fully under your control. If today you understood that that small second of instability is not something you should ignore, but rather a signal that deserves attention, then this channel is for you. We don't speak from fear here. We speak from intelligent prevention. If you want to keep learning how to protect your balance, your brain, and your independence after 60, subscribe now and turn on notifications. Because in the upcoming videos, we're going to dive deeper into other silent factors that may be affecting your stability without you even realizing it. Disclaimer: the information shared in this video is for educational and informational purposes only, and does not replace professional medical evaluation, diagnosis, or treatment. Every individual has unique health conditions, so before making changes to your diet, supplementation, or exercise routine, it is essential to consult with your physician or trusted healthcare professional. Vitamin D supplementation should not be started without prior blood testing and medical supervision, as both deficiency and excess may have consequences. This content is intended to encourage prevention and informed decision-making, not to replace personalized medical advice.